Hello, my name is Tracy Sabay, and this is my patient Maureen, and we're going to be doing a head-to-toe complete physical assessment. And prior to coming in the room, we went ahead and Maureen changed clothes. She was wearing clothing that was appropriate for the weather. She emptied her bladder. We took vital signs, height, and weight, and we also did the BMI index. So we're going to start. I'm going to start by inspecting your head and face. So I'm just looking at symmetry here. I'm going to scoot this out of the way a smidgen. Okay, so her skin is appropriate color for her ethnicity. Eyes are symmetrical. Nose is symmetrical. And there's no lesions, masses, or any injuries that I'm able to see. Now I'm going to go ahead and palpate her skull. And what I'm doing is checking to see if there's any masses, any type of bulges, lumps, if I feel any injuries, deformities. And she's normocephalic. Her hair is brown in color. It is very shiny and well kept. It's of a moderate thickness and it's evenly distributed. There's no patchiness, baldness, dandruff, anything of that sort. So her hair looks good. I'm going to now palpate your facial bones, starting kind of at the top. Let me know if you have any pain or discomfort. Okay, everything seems symmetrical. Was there any discomfort during that part of the exam?
No.
Okay, all right. So now I'm going to assess your temporomandibular joint. So I'm going to put my hands on the side of your face and have you open your mouth and close, open and close. So there was no popping, no noises that would indicate there was something wrong with her temporomandibular joint. It was a smooth open and close of the mouth. So now I'm going to assess her sinus regions, and there are 4 of them in the head, but we've just been using the frontal and maxillary. They're the easiest to palpate. Any pain with that?
No.
Okay. And how about here?
No.
Okay, very good. All right, so now we're going to go ahead and test light reflex, and to do that, we're going to use a cotton swab. And what I'm going to do, Maureen, is I'm going to run this cotton swab over your forehead, on your cheeks, and your chin. You let me know if it feels even on both sides.
Yes.
Okay, great. So the next part of our exam is going to be the eyes. So the first thing we want to do is examine the eyelids and the eyelashes. And her eyelids, she's able to open and close her eyes easily. There's no drooping or ptosis of the eyes noted. And her eyebrows are evenly distributed, the hair is, as well as her eyelashes. I don't see any abnormalities, no bumps, masses, or any lumps present. There's no exudate, redness, drainage from her eyes currently. She opens and closes them easily. So now I'm going to inspect her sclera and conjunctiva. So what I need you to do, Maureen, is I'm going to pull down on your lower eyelids. I want you to look straight up. Okay, and her sclera is white. There's a few blood vessels noted, but no jaundice or any reddening of the eyes. Her conjunctiva is pink, and again, there's no exudate, discharge, redness, swelling, any of that. So now I'm going to palpate the lacrimal gland. Any pain with that?
No.
Okay, and I don't feel any swelling or anything. I'm going to palpate your lacrimal sac. There's no excessive tearing, no redness, nothing noted. Did that hurt at all when I assessed the lacrimal sac?
No.
Okay. All right, so now what we're going to do is I'm going to have you look at this eye chart here. This is called the Rosenbaum chart. And I want you to hold it about 14 inches away from your face and read the smallest line that you're able to.
4, 2, 6, 7, 3, 9.
Okay. So she read 426,739. That is the bottom line, so that would indicate 20/20 vision. So that's very good. So now we're going to go ahead and perform the cover-uncover test. So what I want you to do, Maureen, is stare straight ahead at a fixed object and then cover this eye while I observe the other eye. And we'll do the same on this side. Okay, so no strabismus was noted during that test. Now we're going to assess the visual fields. So what I want you to do is look at me, and I'm going to have my fingers up here in 3 different positions, and I want you to tell me which side you see my finger moving on.
That one. That one. That one. That one. That one.
Perfect. Very good. Okay, so now we're going to assess the extraocular eye movements, and we're going to do that by, I'm going to form an H pattern with my finger. Now I want you to have your head and chin completely still during this, so just follow me with your eyes. Very good. Okay. Alright, so now what we're going to do is we're going to do the swing light check to test for pupil reactivity. And her pupils are equal and reactive to light and round. I would say 3 millimeters in brisk. Okay, so now we're going to inspect the ears. The first thing we're going to do is look at the placement and alignment of her ears. And just by visualizing her face, her ears are symmetrical, they're appropriately placed. There's no obvious deformities or lesions, masses, anything noted. So now I'm going to palpate her auricles. So Maureen, I'm just going to touch your ear a little bit. And I'm feeling for any like hardness, lumps, anything that would be abnormal. Does that hurt at all?
No.
Okay, good. All right, so everything's checking out so far. The auricles are normal. I'm going to go ahead and do a hearing test with you. It's called a whisper test. And what I'm going to do is I'm going to whisper a combination of letters and numbers into your ear. And I'm going to be out of view so you can't see my lips move. So I want you to repeat it back to me and at least get 50% of it correct, okay?
JAY09.
Very good. Now I'm going to come around this way.
MAL14.
Perfect. Okay, so she got both of those 100% right. So that's a very good indicator of hearing. So now we're going to do a Weber and Rene test. And what I'm going to do, Maureen, for the Weber test is I'm going to strike this tuning fork so it starts vibrating. I'm going to set it on the top of your head. And I want you to let me know if you hear the sound equally in both ears or if one ear is better than the other, okay?
Okay.
All right.
Both ears.
Both ears? Okay, very good. All right, so now we're going to perform the Rene test. And what I'm going to do for this is going to check bone conduction versus air conduction. And I'm going to strike the tuning fork. I'm going to place it on your mastoid bone. And I'm going to be counting the seconds. As soon as you stop hearing the noise, I want you to let me know, okay?
Okay.
Okay, so I got 11 seconds on that side. Okay, so now what I'm going to do is I'm going to strike the tuning fork again, place it against 1.5 to 1 inch away from your ear, and I want you to tell me when you can no longer hear the sound, okay?
Okay.
So that was 22 seconds. So far that's normal. We want the air to be twice what the bone conduction is. So your bone conduction was 11 seconds and your air conduction was 22. So that's right on target. We're going to do the same thing with this side. So let me know when you no longer hear the sound.
Okay.
Okay, so that was 10 seconds. And now I'm going to strike the tuning fork again and place it ½ inch to an inch away from your ear, and let me know again when you no longer hear it. Okay, so that was 20 seconds. So again, that is the normal, what we would expect to see in the normal Weber and Renee test. Okay, so now what I want to do is I'm going to inspect your ear canals. So I'm going to use the otoscope, and I'm going to be checking your ear canals as well as your tympanic membrane. Okay, I'm going to do this on both sides, and let me know if at any point you have any pain or discomfort. Okay, sorry, the light was. So for this, you want to pull the auricle up and back. Sorry, I'm going to scoot that out of the way. Okay, so her ear canal is free of excessive cerumen. There's a few noted hairs in there scattered about. There's no foreign objects. Her tympanic membrane is intact, no perforations. It's pearly gray, transparent, and has conicity to it, and also concavity at the umbo. So I'm going to go ahead and remove this, and we're going to do it with the next side. Okay, same thing with this ear. Few scattered hairs here and there, no excessive cerumen, no foreign objects, and this tympanic membrane is pearly gray, translucent, has conicity as well as concavity at the umbo. Alright, so now we're going to go to the nose, and I'm going to go ahead and inspect the structures of your nose. So your nose is symmetrical. The septum is midline, no deviation. Both of her nares are present. I'm going to go ahead and occlude one nair. Now I want you to breathe normally through the other nair, okay? Not through your mouth. Okay, now this side. Great. So we just checked the patency of her nares, and both of her nares were patent. So now we're going to look inside her nose. And I'm going to inspect the mucosa, the septum, and the turbinates in your nose, okay? Okay, the septum, there's a tiny amount of clear discharge present. There's a few scattered hairs. Mucosa inside is pink. There's no perforations. The turbinates are pink as well. Okay, now I'm going to come around the other side and check your other nair. Same thing on this side. There's a little bit of clear discharge on the septum. There's a few scattered hairs noted, and her turbinates are pink. There's no perforation and no deviation of the septum. Okay, so now we're going to inspect the mouth and pharynx. And what I'm going to do first is look at your lips, your buccal mucosa, gums, hard palate, soft palate, and the floor of your mouth. Okay? So first looking at her her lips. Lips are symmetrical. Can you smile for me? Good. She has no facial droop. They're pink in color, moist, intact. There's no lesions, ulcers. So now I'm going to inspect your buccal mucosa. If you don't mind, I'm just going to use this light, as our light here is not as good. So her buccal mucosa is moist, pink. Everything is intact. There's no ulcerations noted, no lesions. So now I'm going to go ahead and inspect her gums. So I'm going to pull your lip down a little bit. Gums are intact. There's no edema, redness, drainage, swelling. Same thing with the top. Okay, and I'm going to go ahead and look at your hard palate. Hard palate is intact, no ulcerations, lesions, redness, exudate. Okay, now I'm going to have you lift your tongue up for me. Her frenulum is midline. The floor of her mouth is free of any ulcerations, any lesions, any white patches. Okay, so go ahead and put your tongue down. I'm going to go ahead and use a tongue depressor because I want to check your soft palate. Okay, soft palate is intact. Again, pink to color, moist, no lesions, exudate, redness, any tenderness. Okay. All right, so now we're going to inspect the oropharynx, and I'm going to look at your anterior posterior pillars, your uvula, tonsils, posterior pharynx, and then I'm just going to assess for mouth odor. Okay. So her tonsils are intact. Her anterior posterior pillars are intact, free of exudate, lesions, white patches, redness, swelling. The uvula is midline. It's pink, no redness, no exudate, no white patches noted. Same thing with the tonsils. There are tonsillar crypts in there, but they're free of any debris. And they're pink, no exudate, no swelling, nothing of that sort. Posterior pharynx, I'm just going to pull down just a little bit. And again, this is pink, moist, intact, no ulcerations, lesions, redness, white patches. And there was no offensive mouth odor noted. So I'm going to kind of look at your teeth now, Maureen. I know our lighting isn't the best here, but I'm going to use this light source. And I'm just going to count your teeth. So she has no missing teeth. Her teeth are straight. They're white in color. The enamel is intact. They're shiny. She has 28 teeth, so I'm assuming you've had your wisdom teeth pulled?
Yes.
Okay, great. And surface characteristics, her teeth are not worn. There's no caries noted. She looks like she takes really good care of her teeth. So now I'm going to look at your tongue. So if you could stick your tongue out. Okay, so her tongue is pink, moist. It's intact. There's no fissures. There's no ulcerations, lesions present on her tongue. It is symmetrical. And can you go ahead and move your tongue in all directions? Perfect. Her tongue moves in all directions. Okay, now Maureen, this is the part that everybody hates. I'm going to check your gag reflex, okay? Okay, so her gag reflex is intact. And then I want you to open your mouth and say, ah.
Ah.
Perfect. Okay. All right, so now we're going to jump to the neck. I'm going to go ahead and inspect her neck for symmetry, smoothness of the neck, as well as the thyroid. So her neck, the skin is appropriate for ethnicity. I see no lesions, any masses, bumps, lumps, injury. Everything is symmetrical. Can you go ahead and take a swallow for me? Good. I feel her thyroid moving as she swallows, and does not feel swollen. Does this hurt at all when I push? Mm-mm. Okay. All right. So now I'm going to check for JVD, which is jugular vein distension, and it works best when the patient's at a 45-degree angle. So if we could just have you kind of lean back. All right, very good. And I'm just going to assess your neck. I'm looking at it right now. Okay. We'll look on the other side. Okay, sorry about that. And I'm not observing any jugular vein distension. That would be pulsations that would be visible. All right, so now I'm going to perform active and passive range of motion exercises with you. And then I'm going to test your resistance against my hands. So can you move your neck in all directions for me? Very good. Okay, now I'm going to kind of manipulate your neck as well. Sorry, this is uncomfortable. Okay, perfect. All right, now what I want to do is I'm going to kind of press on your neck, and I want you to try to push against one of my hands. Good. And again. Very good. Okay, can you do the shoulder shrug for me? Okay, do it again. Perfect. Now I'm going to palpate your carotid pulses, and it's very important that we remember to do one at a time. She's got a nice, even carotid pulse. I would say it's 2+. Check the other side now. Again, nice, even carotid pulse. Okay. All right, so now I'm going to check the position of your trachea. Her trachea is midline, so that is what we want to see. I'm also going to palpate your thyroid, so if you could go ahead and swallow again so I can locate it. Good. And it feels normal. I don't feel any enlargement or masses, no lumps, bumps. There's no red streaking. Was it tender at all when I pushed on it? No. Okay, so now I'm going to palpate your lymph nodes. So first I'm going to do the preauricular. Come around to the side and do the other. Okay, I'm going to do your postauricular. Good. I'm going to do your occipital. Let me know if you're having any tenderness anywhere. But so far the lymph nodes are of normal size. None of them are swollen or painful to the touch. Okay, very good. So now I'm going to do your tonsillar lymph nodes. Any pain there? Good. And I'm sorry I keep going back and forth. This is a little easier that way for me. So now I'm going to go ahead and do your superficial cervical chain. Is that hurting at all? Okay, good. All right, now I'm going to do your superficial cervical chain. Is it tender at all? Okay. And I'm not feeling anything enlarged, so that's really good. Good. Okay. Now, if I could, I'm going to do your supraclavicular. Any tenderness? Okay. Come on the side and do it. Good. Now I'm going to do your infraclavicular. that tender at all?
Mm-mm.
Any tenderness there? Okay, now I'm going to get underneath you here and do your axillary nodes.
Take a break, Tracy.
Any pain?
Mm-mm.
Okay, go ahead and do your deep cervical.
Take a break.
And your submental. Any pain?
Mm-mm.
Okay. And then I'm going to do your submandibular. Any pain there?
No.
I can't wait anymore. You gotta.
Okay, I'll now be auscultating the carotid arteries and the thyroid. So, Maureen, what I want you to do, and for this we use the bell, I would like you to take some breaths and hold it when I tell you to, and then I'll start listening. Okay, go ahead and take a deep breath and hold it. Good. Let me come around this way. Go ahead and breathe. Give you a few breaths to catch up. Okay. Deep breath and hold it. Good. So we noted no bruise in the carotid arteries. I'm going to go ahead and listen to your thyroid, but can you swallow for me so I can locate it? Good. Okay. So take a breath and hold it. And again, no bruise noted. Okay, so now I'm going to assess your upper extremities. I'm going to go ahead and inspect and palpate your hands. There's no bony deformities. Skin looks great. It's clean, dry, and intact. And there's no lesions, no bruising, nothing. Just going to lift this up. Make sure you don't have any lumps, bumps, anything like that. No, your arms are symmetrical. I don't see any enlargement or edema anywhere. Hands look good. Okay. So now what I want to do is just feel around on your shoulders a little bit. Okay. Your shoulders feel very symmetrical. I didn't note any lumps or bumps, masses, anything like that. So I'd like to look at your nails next. You have good capillary refill, less than 3 seconds. Nails look good. There's no breaking. There's no splitting. The angle is normal. Again, good cap refill on this side. Nails are strong. There's no splitting of the nails at all. Okay, and your skin is appropriate color for ethnicity. So now what I want to do is I'm going to assess your radial and brachial pulses bilaterally. And they're 2+ regular pulses. The brachial is the same, 2+ regular. Okay, so now I'm going to take a look at your back and your posterior chest. And I'm going to go ahead and look at the skin and the thoracic configuration. So skin is intact. She's got some freckling to her back, but nothing open, no sores, lesions. Thorax is symmetrical. Okay, now I'm going to palpate and percuss the costovertebral angle. Let me know if this hurts at all. No? Not anything? Okay, very good. Okay, she has no lesions on her back, no bruising, nothing. Just skin is intact. Okay, So her scapulas are symmetrical as well. Any pain or discomfort when I palpated anything? Okay, so now I'm going to observe you breathing, so go ahead and lay back. Okay, I'm just going to observe your respirations to see that you have a regular chest rise and fall. You're not using any accessory muscles. Okay. Very good. Breathing looks good. Okay, non-labored, regular, easy, and symmetrical. So now I'm going to palpate for expansion and tactile phremesis. So I'm going to place my hands on your back, and please take in a few deep breaths for me. I want to see if my thumbs move symmetrically. They do. Okay. And I see no difficulty in breathing. She's relaxed, breathing easy. Okay, so now I'm going to check for tactile phremesis. Palpate for tactile phremesis. I'm going to palpate both sides of your back simultaneously and symmetrically. And I'd like you to keep saying 99 until I stop palpating.
99, 99, 99, 99, 99.
Good. Okay, so I felt symmetry and vibration. So next I'll percuss the posterior chest bilaterally. So I did a total of 10 spots, and I heard resonance throughout all the lung fields. So now I'm going to percuss the lateral chest wall, if I may. Good. And again, resonance was heard. We're doing this in a total of 4 spots. Okay, so now we're going to do diaphragmatic excursion. And for that, I need to grab one tool here. Okay, Maureen. So I'd like you to take in a deep breath and hold it. Now I'm going to percuss along your scapular line. Until I notice that there's dullness. Okay, go ahead and breathe. Go ahead and take in several breaths. Exhale as much as possible, and then hold it. Okay. So I'm noting the change of dullness to resonance. Okay, go ahead and breathe for a few cycles. I'm going to do the same thing on the other side. I'm going to go ahead and measure that. And this one is about 3.5 centimeters. So I'm going to come on your other side and do this again. Take in a deep breath and hold it. And again, I'm going to go along the scapular line until I locate dullness. And I'll mark that with a marking pen at the scapular line. Okay. I noted the change to dullness from resonance. So I'm going to go ahead and mark that. Okay, go ahead and breathe. Take a few breaths in, and then I'll go ahead and check the next area. Okay, so now I want you to take a couple breaths really deeply in, and then exhale as much as possible and hold it. And now I'm noting a change from dullness to resonance. Okay, I'm going to go ahead and mark that. Measure. Okay, and that's again about 3.5 centimeters. So 3 to 5 centimeters is average. So now I'm going to go ahead and auscultate the posterior chest, and I'm going to listen side to side so I can see if there's any changes. And we use the diaphragm for this. So deep breath in and out, please. And we do this for 10 spots on here. And her lungs are clear to auscultation bilaterally. I didn't notice any adventitious breath sounds. So now I'm going to go ahead and I'm going to listen to the front of your chest for a total of 8 spots. And I'm going to be comparing side to side. Deep breath in and out. Two more. Very good. So we listened for a total of 8 spots, and throughout her lung fields, her lungs were clear to auscultation. So now I'm going to look at the, listen to the lateral sides and compare those side to side, see if there's any changes. And we're going to listen in 4 spots. Good. That side is clear to auscultation. I'm going to come around here. Deep breath, please. Good. Yeah. Okay, now I'm going to inspect the skin of her anterior chest. So I'm just going to go ahead for purposes of privacy and just look down. And her skin is warm, it's clean, dry, and intact, no lesions, nothing noted. She's having no difficulty in breathing. Her chest rises and falls symmetrically. She's not using any accessory muscles or feeling the need to be in the tripod position. Do you feel any dyspnea? No? Okay, very good. Okay, so I'm going to check now for pulsations or heaving. And what we're worried about with this is a AAA or an abdominal aortic aneurysm. And I don't feel any pulsations or heaving. So next I'll palpate the chest wall, starting with the apex left sternal border. And I don't feel any thrills, heaves, or pulsations. So now I'm going to locate the apical impulse. For privacy purposes, I'm going to listen underneath the gown. And I'm just going to listen for a while. No adventitious sounds. Okay, now we're going to go ahead and check for tactile fremitus on the front. So what I need you to do is just repeat 99 as I palpate.
99, 99, 99, 99.
Good. Okay, so I did feel symmetrical vibrations. There was no lag, anything like that. So now I'm going to palpate the infraclavicular and axillary nodes again. I know we did that with an earlier assessment, but we're going to go ahead and do that again. I'm going to do it bilaterally. Any pain when I press here? Okay, axillary nodes. Any pain?
No.
Any discomfort?
No.
Okay, so I didn't note any swelling, redness that I could see. No edema, no red streaks, nothing of that sort. So now it's time to symmetrically percuss the anterior chest. So there's going to be 8 spots on there that we percuss. I'm actually going to come around to your right if that's okay. This is a total of 8 spots. Okay. All right, so now I'm going to go ahead and auscultate your heart sounds. And there's some points that we're looking for. We want to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Good. She's got a normal S1, S2. I didn't hear any gallops, clicks, rubs, murmurs, nothing like that. No friction rubs, snaps. I'm going to go ahead and listen to her lungs on the front as well. Deep breath. Again. Very good. So no adventitious breath sounds heard during that. Everything sounded good. Her lungs were clear to auscultation everywhere that I listened. So we're going to move on to the abdomen, and for that you want to be on the right side. So first I'm just going to inspect her abdomen. Yes, please. And what I'm going to be looking for is characteristics, contour, pulsations, and movement. So first I'm just going to look at her abdomen. I'm going to pull this down just a smidge. And she has no bruising, no ascites. We've got a scar here that's old, looks well approximated. Must be from a previous surgery. Her skin color is appropriate for her ethnicity. There is some striae from previous pregnancies, but it is shiny and silvery kind of colored. The venous network is visible in her abdomen. I don't note any lesions, nodules, masses, anything like that. I like to do bimanual palpation. Okay. I'm going to listen to her bowel sounds. We want to listen in all 4 quadrants. Very good. Okay. So she has positive bowel sounds in all 4 quadrants. They were not hyperactive or hypoactive. So now we're going to move on to the arteries. And the first one we're going to listen to is the aorta. And we use the bell for this. We're listening to make sure that there's no bruit. There's no bruit heard over the aorta. Now I'm going to auscultate the renal arteries. I'm not hearing any bruits. Then I'll go ahead and auscultate the iliac arteries. No bruits heard. And last but not least, we're going to auscultate the femoral artery. Very good. Sorry, tripping over your sheet there. Okay, so now we're going to do some percussing. I'm going to go ahead and lift this gown up and keep you covered up. So first we're going to percuss for tone. We're going to do the liver borders and splenic dullness. So the liver runs from the right over to the left. So we're going to go ahead and percuss the liver borders. Dullness is generally heard over the portion of the liver, the greater portion. And there's tympany also associated with the liver. And I didn't feel any masses as I was going through and percussing, but over the stomach and intestines, it's tympany that you will hear. Okay, so we want to now assess for splenic dullness, and spleen is actually going to be on her left-hand side, kind of hangs out underneath where the liver is. We'll go ahead and assess for splenic dullness. And you can hear the dullness. Alright, let's pull this down for privacy purposes. I always like to be on the right-hand side. The dullness from the spleen is heard from the 6th to the 9th rib generally. And there's a trob space too that sounds tympanic. Okay, so when you want to measure the liver borders, you start at the right midclavicular line over an area of tympany, proceed to an area of dullness, then percuss up along the border. Sorry, I think our computer shut down. And a normal size for the liver will be between 6 and 12 centimeters. So it's very, I want to say it's going to vary from person to person what they think size-wise. But usually for a female, it's less than 10 centimeters. Okay, so now I'm going to go ahead and do some palpation. So I want you to lie as flat as possible. And is it okay if I go ahead and press on your stomach? And I'm going to palpate in all 4 of her abdominal quadrants. And what we're feeling for with light palpation is any like superficial type masses, any lumps, bumps, nodules, anything of that sort. And our abdomen is smooth and soft. Any areas of tenderness so far? Okay. And she has no guarding. She said it's non-tender. No tenseness, no rigidity. And now next I'm going to perform some deep palpation. So let me know if any of this palpation is causing you any discomfort, okay? So I'm gonna palpate in all 4 quadrants. This is to feel for any masses or nodules you may have missed with the light palpation. And generally it is a little uncomfortable for the patient. I'm not feeling any lumps or nodules. So yeah, no masses or anything noted on the left or right costal margin. And any of this hurting at all, Maureen?
No.
Okay. Alright. So now I'm going to kind of go ahead and palpate her kidneys. They're kind of hard to find, but does that hurt at all?
No.
How about that?
No.
Okay. So yeah, her kidneys, right and left, were free of any masses, nodules, or lumps. So now I'm going to check the midline of her abdomen. I want to see if there's any aortic pulsations present. So you can do that by simply palpating. And again, with that, we want to make sure that there are no pulsations, because that could indicate that she may have a abdominal aortic aneurysm. So I'm going to go ahead and palpate the midline. And I'm feeling any pulsations. Am I causing you any tenderness, any discomfort, pain? Okay, very good. So now we're going to kind of go through and I'm just going to check your abdominal muscles. Sometimes, especially in pregnant women, the rectus muscle will start to open up a little bit. So I just want to make sure that you have even muscle tone. Yep. She has even muscle tone. No tenderness with that?
No.
Okay. Muscles were symmetrical, equal in strength bilaterally. I'm gonna go ahead and cover you back up, Maureen. All right, so now we're gonna move on to the feet and legs. So I'm gonna go ahead and uncover your bottom part here. I'm gonna pull her pants up as far as possible, and just observe the legs for symmetry. You want to make sure that one leg isn't larger than the other leg, because that could indicate that there's a clot on there. And her skin is warm, dry, intact. She's not sweating. She doesn't have any moisture on her skin. Her skin isn't dry. It feels well moisturized. The hair distribution is even on both sides. Temperature is warm. No edema is noted at all. And I'm going to go ahead and take your socks off, okay, Maureen? That way I get a little bit better view of your feet and everything. Right now I'm assessing her dorsalis pedis pulse. And it's regular, even, 2+. I'm going to go ahead and move up a little bit. And this one's harder to find, the posterior tibial. So I apologize if I'm tickling you in any way. And again, the pulses are even. I would rate them as a 2+. They're regular. And now we're going to go for the popliteal, which is directly behind the kneecap. Kind of have to search around a little for it, but it's there. And that's 2+ again, regular, not bounding. Very good. Okay. I'm going to go ahead and pull your pants legs back down. Okay. Now you can go ahead and sit up for me, Maureen. I'm going to go ahead and do a neurological exam on you. Can you tell me your name?
Maureen.
Can you tell me your full name? Sorry.
Maureen Dunchak.
Okay, and what's your birthday?
12/19/79.
Okay, and where are we right now?
We're in St. Louis, Missouri.
And what exactly, where exactly are we?
Holland.
Ballin. Very good. Okay. And who is our president?
Barack Obama.
Good. Okay, so I'm going to ask Maureen if she has any numbness or tingling in any of her extremities.
Nope.
Okay, so she's not having any altered sensations or anything.
No.
She's alert and oriented ×4. Okay, welcome back. Sorry, we had to take a break real quick. We're going to go ahead and go through the cranial nerves, starting with one, which we don't have to check, but I'm going to go ahead and list them all. One is the olfactory nerve, and what we do for that one to test it is we have the patient close their eyes, and we provide 3 different odors that are distinct that everyone would know what they smell like, and we have them occlude one nary and sniff with the other one, and then change nares and sniff with that one, and make sure that they can correctly identify the odor. So what we use is coffee, peppermint, and vanilla, and those are all things that most people would know what they smell like, so that's what we use for that. Cranial nerve number 2 is the optic nerve, and we did check that with the Rosenbaum chart, where Maureen scored 20 20 vision. I am going to do an exam of her fundi. Okay. Right, sorry. Good. And I'm able to visualize her arteries of her eyes. There's a red-white reflex. Okay. And also for optic, we check for pupil constriction, and we do that with a pen light. And her pupils are equal, round, reactive to light, and accommodation. We checked her visual fields earlier when we did the fingers out to the sides, as well as the H pattern that checks the 6 cardinal fields of gaze. So optic nerve number 3 is the oculomotor nerve, and with that you also check, these kind of go hand in hand, you check for pupil constriction with the pen light, which we just did, and I'm going to ask Maureen to open and close her eyes. And she has no problem doing that. Her eyelids close completely. For trochlear, which is cranial nerve number 4, that's the 6 cardinal points of gaze, as well as perla, which we've already done. And abducens is the extraocular movements, which is when we do the H pattern, which we performed previously during this assessment. Cranial nerve number 5 is trigeminal. So for this one, I'm going to palpate her temporal and masseter muscles as she clenches her teeth. And I don't feel any crepitus or anything abnormal. She's able to have smooth muscle movement when she clenches her teeth. So another part of the trigeminal is to do the cotton swab to the forehead, cheeks, and chin, which we did in an earlier assessment. So we're moving right along to cranial nerve number 7, which is the facial nerve. So I'm going to go ahead and ask Maureen to smile for me and frown. Okay, now I'm going to have you close your eyes tightly while I try to open them. Good. And lift your eyebrows. Show your teeth. And puff your cheeks. Now, if we did suspect facial nerve injury, then we would go ahead and do the taste test, which tests, it's a third of your tongue for each one. The very back of the mouth would be where the sour taste would be present. The middle of the tongue would be salty, and the front of the tongue would be sweet. And we usually only do that if there's a suspected facial nerve injury, or if the doctor specifically wants that performed. So cranial nerve number 8 is the acoustic nerve. Maureen and I were able to carry on a conversation, so with our general appearance, I knew already that she was able to hear my voice and was able to respond appropriately. We did the whisper test, which Maureen did excellent with. She got every single one of the letters and numbers correct. We did the Weber test, which is where I put the tuning fork that's vibrating on top of her head. And if the patient were to say that they heard the sound better in one ear than the other, then what you'd want to do is repeat the test and occlude one ear at a time, and the patient will hear the sound better in the ear that's occluded. We also did the Rene test, which is where we place the base of the tuning fork against Maureen's mastoid bone, and we timed it while she listened to it vibrate and told us whenever the vibration sound stopped. We noted the number of seconds with that. It was 11 and 21 one time, and then 10 and 20. So that's bone versus air conduction, and the air conduction should also be always be 2 times what the bone conduction is, and hers was almost exactly twice of what the bone conduction was. So cranial nerve number 9 is the glossopharyngeal, and we did that as well, where I depressed Maureen's tongue with the tongue blade while she says ah. I did check her gag reflex as well, and it was intact. Cranial nerve 10 is the vagus nerve. That is where you do the ah and gag reflex. I apologize. Cranial nerve number 11 is the spinal accessory nerve, and that's where you ask the patient to rotate their head forcibly against resistance, which she did earlier as well. And she had no problem in doing that exam. And what you do is have the patient rotate their head forcibly against resistance to the side of the chin or sternomastoid. We had her shrug her shoulders, but I'm going to do it again with more resistance. Very good, Maureen. And it should be strong and symmetrical, which it is, the trapezius muscles. Cranial nerve number 12 is the hypoglossal, and this is where we ask the patient to stick the tongue out and note forward thrust in the midline. So we did do that earlier, but I'm going to have Maureen do that again. Good. And she had no problem. Her tongue didn't deviate to one side. It was midline. And can you move your tongue from side to side? Good. And lastly, can you repeat the words light, tight, dynamite?
Light, tight, dynamite.
Good. So that's the cranial nerves. We're now going to jump back into the musculoskeletal system, and I'm going to check her reflexes. We have 3 that we're going to check. We're going to check the brachial on her arm, we're going to check her knee, and her Achilles tendon. And we're going to do this bilaterally. Good. So that's intact. Good. Okay, now I'm going to do her knee. And watch out, you don't want to stand in front of somebody because you get hit. Good. Okay. And now we're going to do the Achilles tendon. So with this one, you lift up on the patient's foot and hit the back of it. Good. So those were the reflexes that we did. Now I'm going to check her muscle strength. And what I'm going to do is have her hold her arms out, kind of like you're doing the chicken dance. And I'm going to try to attempt to push down on her arms. And she has equal strength and is very strong, symmetrically, equal strength bilaterally. I'm going to have her squeeze my hands as hard as she can. Good. And I'm going to have her push down on my hands like she's driving the car. Very good. And pull back towards you. Perfect. So all of her her grips, pushes and pulls are all strong. So there was no weakness on any side of the body. We'd be worried about that, especially if there was a suspected stroke. But hers were symmetrical bilaterally. So now what we're going to go ahead and do is examine her cervical spine, which is C1 through C7. And we want to just make sure that there's a normal curvature and no masses or bulges. So I'm going to go ahead and assess that. And it starts at the base of the skull. Any pain or tenderness?
No.
Okay, very good. Okay, so her cervical spine has normal curvature to it. Again, there was no masses or bulges, and she didn't experience any pain during it. So now I'm going to go ahead and check her lumbar spine, which is between the pelvis and the ribs, and it's L1 through L5. So I'm going to have Maureen stand up and bend over for me. And try to touch your toes. And I'm just going to kind of feel along her whole entire spine for any abnormalities. Okay, you can stand up. And I did not feel any. We would be worried about kyphosis, which is where they're hunched over, or scoliosis. And a lot of times kids will get that done during their school year as part of like a routine testing. So this concludes our video on a head-to-toe assessment, and thank you for watching.